Injuries legally they can be classified into two: simple hurt and grievous hurt. Now those injuries which are permanent or which cause scars, etc., those are classified under grievous hurt. So it falls under 116 BNS, previously 320 IPC, and there are 8 clauses. We just run through them very fast. So first one was emasculation. Second one was permanent privation of sight or either eye. It means destruction to eyesight, right? Or vision. Permanent privation of hearing or either ear. Permanent privation of any members or joint. Members is any appendages from the body or any limbs, etc. Permanent privation of powers of any member or joint. So if you have injury to say any tendon, rupture which or any like burns which causes joint contraction and you cannot use that particular joint or limb, then that falls under clause 5. Clause 6 is permanent disfiguration of head or face, like any long scars on the face. Seventh one is fracture or dislocation of bone or tooth. Eighth is any hurt which endangers life, causes the sufferer to be for 15 days in severe bodily pain, unable to perform ordinary tasks. See, it is important to remember them in order. So we look at 5 clauses in this slide. First one was emasculation. Second one was pertaining to the eye. Third one to the ear. Fourth one to either member or joint. And fifth one was to the parts of either member or joint. Sixth clause is permanent disfiguration of the head or the face. Seventh clause is either fracture or dislocation of the tooth or the bone. And eighth clause, it is 3 parts. First one is endangering life. Second is it causes the victim to be in severe bodily pain for 15 days. And third part is unable for the victim to follow even ordinary daily tasks for 15 days. Emasculation, as per definition, it is deprivation of a male of his masculine vigor. Just remember, you remove things from a man that make him a man. It could be 3 things: either cutting of the penis, second is removal of testes, which is called male castration, or third, injury to testis or spinal cord at the level of L2, L3 vertebrae, which results in permanent erectile dysfunction. Now, whether or not it is treatable is not considered. If it causes permanent injury, it is termed as emasculation. And here, even sterility and potency are also covered. And if only one of the testes is damaged, it falls under clause 4, which is permanent privation of member or joint. It does not come under emasculation. Second clause is permanent privation of sight or either eye. The most important thing is in its permanency and whether it results in the loss of sight, whether it disfigures the person as well. So here I want you to look at the picture. Now, deep aberrations, which involve the corneal stromal layer, or if it's within the central visual axis, okay, dislocation of lens, breaking of the zonules, retinal or choroidal tears, optic disc lacerations, all these are marked in the picture. If you can just correlate with the picture, it'll be easier to memorize. So it is not necessary that both the eyes need to be affected. Even affecting one is sufficient. And so the nature of impairment of eye is usually measured in case of loss of visual acuity and impairment of the visual field. Clause 3 talks about permanent privation of hear or either ear. So the most important thing here is again permanent deafness. So any blow on the head or the ears, if it causes injury to the tympanum, to the ear ossicle, or to the auditory nerves, or if it's injury with a foreign object like a sharp stick that was put in and it causes a tympanic perforation, um, it comes under clause 3. So here again, there's a statement here: tympanic membrane perforations may heal spontaneously. So it is important to review after 2 weeks to check if it is healed or if it's permanent. And audiometric assessment can be done to document the hearing loss. Clause 4 talks about permanent privation of any member or joint. Now, see, privation is an act which results in a deprivation or loss of hear, an organ or limb which is responsible for a distinct function. So, it could include like external, like the whole eyes, the outside of the ears, the nose, the mouth, hands, feet, even joints, small or big joints are considered. But here, hair and nail, it is not considered under clause 4. Permanent privation or destruction or permanent impairment of the powers of any member or joint. See, the thing is, you need to use your limbs or joints for normal functions of the body. So, when you cannot use the organ or limb that is responsible for a distinct function, that falls under clause 5. So, it will include cutting or severing a tendon anywhere between its origin, like its root or insertion. The function is permanently lost. So it results in a deformity or loss of movement and weakness. And the loss of power, it need not be 100% loss of power. Even say 50% loss of power is considered under clause 5. For example, it could be rupture of the Achilles tendon, right, which could result in loss of movement, or contracture of joint due to burns, that could also result in loss of power. Permanent disfiguration of head or face is changing the personal appearance of the subject because of some external injury, which does not weaken the person. So, a person is said to be disfigured when a reasonable observer, when they find that the altered appearance of that person is distressing or objectionable, it comes under clause 6. Like, for example, if you chop off a person's ear or a nose, it would cause disfigurement, but if it does not cause any disability, then it would come under clause 6. So even a large cut on the face, or a branding means like with a hot object you make like a tattoo of sorts, it leaves a permanent scar which causes disfigurement. Even injuries to the eyes, it leaves residual effects like ptosis, entropine, or squint after healing. Hmm? That comes under clause 6. And finally, opinion of disfigurement should be given after complete healing, since the doctor cannot judge whether the disability is permanent or not. Now, fracture or dislocation of bone or tooth is the seventh clause. So, when we talk about fracture, it could be a break in the bone. It could either be because of cutting or splintering or any rupture or fissure in the bone. See, here it need not be a crack or a break throughout. It just needs to be a crack from the outer to inner surface, which causes displacement. And fractures are possible without trauma in osteoporosis because of the low calcium and the low bone density in general. And in terms of dislocation, loss of tooth due to age and disease does not constitute. When you got into a fist fight with someone and then your teeth flies out, that could probably fall under clause 7. And so you need to check for signs of inflammation in alleged trauma. And now some people, they have an inherent tendency of dislocation. For example, they can dislocate their shoulders, but they can also put it back without difficulty. Now, eighth clause is 3 points. First one being endangering life. It means that only the life has been endangered, it has not been taken away. Okay, which is just placing the person in danger of death, not necessarily death itself. Second is severe bodily pain for 15 days. A mere hospital stay for 15 days does not constitute grievous hurt. Third is unable to perform ordinary tasks for a period of 15 days. See, now going to work, running, jumping, driving a vehicle, those do not fall under ordinary tasks, but basic things like going to the washroom, eating food, changing clothes, taking a bath, those are what are constituted under ordinary pursuits for a period of 15 days.